right, so
Nothing
five.
can go wrong.
Right. Ian, thank you so much for coming on our recording session today. I'm super happy to have you on this series. We are going to be talking about everything 3D printing in P&O today. So 3D printing being one of the hot topics in the industry is something that I want to also highlight because a lot of people, especially people in like early careers, are asking, oh, how can I get into 3D printing? How can I incorporate that into my practice? And I'm very curious to ask, could you introduce yourself and how you've gotten into this sector of the industry?
Yeah, I'm Ian. I'm an orthotist. I've been around a long time. I've been qualified for 40 years in September. I
Ooh.
work for a company called Crispin Orthotics, and our additive journey started about 11 years ago, in fairness. We were looking at other elements that we could bring into the business. So we experimented with filament printing, and sort of off the back of that, we realized that it was probably something that we could incorporate into our business. So my colleague, Mark Thaxter, did a lot of investigation, and we went down the route that we've gone now with the Hewlett-Packard printers, the FDM printers, because at the time they were the only polymer printer that would print functional devices, and that was our aim, to produce devices for patients. So we started on that about 6 years ago.
Okay.
I've been very lucky. I do a clinic at the Walton Centre in Liverpool, and my patient cohort are neurological patients who are very amenable to a lot of the properties of additive manufacture, namely devices that are lightweight and dynamic. So we've been at it for a while now. We're up to about 60,000 orthoses
Wow.
provided to date. I've probably done, I don't know, maybe 2,500 at the Walton Centre. So it's very interesting. As somebody who's been in the industry a while, I would say it's helped to revolutionise what I'm able to do in my clinical practice. I'm quite passionate that other clinicians have access, at least, to the knowledge of this technology, and hopefully to be able to integrate it into what they're doing clinically.
Yeah. I completely agree. I think during the early years of my training, I came across additive manufacturing and I was like, this is how I want to be able to practice. I don't like the plaster model. I'd rather have all the 3D scanning where it's easy, efficient, and you have more of the time to spend with patients. So yes, I do agree with you that many more clinicians should get on this train. In terms of how getting Crispin to adopt this technology, how has that changed the sort of devices that you're able to provide to your patients? And how has it made how has it made the business more efficient, so to
I
say?
think, yeah, I think it basically gives us another set of options. It lets you think differently. I'm always keen to say whenever I go out and about that additive is not the answer to everything. As a clinician, it gives us another set of tools that we can work with. I think additive is unique in a number of ways. It enables us to very specifically govern the functional properties of devices. So we can specify areas of rigidity and flexibility. We can determine exactly where they are within the device itself, and how we transition between those different properties within an orthosis. It allows us to produce some very complex geometries because of the manufacturing process. And it gives us the ability to, certainly, one of the examples that I would probably give is in my clinical practice, is that we're actually able to design a condition-specific device. I have patients at the Walton Centre with MND that are referred with head drop, and what was available really was okay, but didn't do the job. So I actually went back to my colleague and said, right, this is what I'm presented with. I need a device that's bespoke, dynamic and lightweight. And we actually designed our neuro collar off directly as a result of a clinical need that was identified as not being fulfilled. And interestingly, that collar now is included in the MND catalogue of approved collars for that particular condition.
Fantastic.
So that was good.
Awesome. So it has quite changed what you're able to do, and that's really nice. In terms of business wise, because I know that 3D printing can be costly. Have you seen any benefits from going that way rather than going the traditional way?
Um, I think there are one of the advantages of additive manufacture when compared to traditional subtractive manufacture is there is a reduction in waste associated with the process. So that can be useful to us when dealing with the NHS, for example, who within the UK are probably still our biggest customer. Um, um, yes, there are costs associated with it. I think from our perspective, we have invested significantly in both the technology and the infrastructure that goes with it.
Yeah,
So it means that the devices are, from a cost perspective, are equivalent or comparable with thermoplastic, probably slightly more. But I think as a clinician, it's being able to promote them as providing something that traditional thermoplastic doesn't. And there are advantages with, for example, with our fixed AFOs, which are less bulky, fit into footwear better. Similarly with our SMOs, and the feedback we've had from both patients and parents for the children we use it on is the fact that they're able to use their own footwear with them more easily. So whereas for certain prescriptions, you may have had to consider a footwear option in conjunction with the prescription itself. We don't have to do that. So I think, yeah, cost-wise, it's slightly higher possibly than traditional thermoplastic, but it is competitive. And I think it's the properties of the device as well, which enables us to use them in clinic to get outcomes we maybe wouldn't have got using other methods.
fantastic. So how can a practitioner, whether orthotist or I don't know, podiatrist, incorporate 3D printing into their practice? What do they need to know and how do they go about it?
Well, I think education really is the key. I mean, one of my roles within the business, and a colleague of mine, Doug Young, who's also heavily involved in our additive manufacturing. One of the things we do both within the organisation and externally is to provide education on additive itself. So I think if you're going to incorporate new technology, you have to understand it. You have to understand what it's capable of, understand what its limitations are, so that you make sure that you use it appropriately. So we provide support both from an educational perspective. I've personally done joint assessments with clinicians if they've got a patient that they feel may be suitable for an additive product but not quite sure. So I think it's understanding it, and we always say keep it simple. So when you're starting out on adopting new technology, then try and pick patients who you are quite confident of your outcomes,
Yeah.
because that confidence breeds success, which breeds more confidence, which means that then you're more able to integrate it within your clinical practice.
Fantastic. And in terms of like career, if you had an orthotist fresh out of school who has invested in the education and now has his skills in either 3D design or understands additive manufacturing, does that make them a more viable candidate, would you say?
I think, yeah, it depends sort of who they're applying to join. Certainly, we do additive end to end. So we design, we print, we also are able to have scanning technology, which our clinicians use. So if we were looking for a candidate to add to our additive side, then obviously if they had an understanding of that technology, that would give them an edge. Maybe I don't think companies in general are going to want to invest in the way that we've done in the technology itself, but they may want to have access to additive manufacture. So if they were looking to incorporate that into their business, then again, if there's a candidate out there who has an understanding of the additive process and the devices, then they may have an advantage in gaining a position where they can sort of assist that company on their own additive journey, possibly.
And just so we also know, so say a clinician is within their NHS clinic and wants to try out this, what's the step-by-step process? Do they just get in touch with Crispin, or how do they go about it?
Yeah, usually we have one of the things we've done is we have a website that's dedicated to our additive manufacture. and people can, can submit queries via the website, and that will get passed on usually to myself or Doug, and then we'll respond to that query. What usually we do is probably initially set up a Teams call just to discuss what the requirements are, give them a bit of an outline. Sometimes on the back of that, I've actually gone out to site and done a bit of a presentation on our additive manufacturer, take some products out so they can see what the products are like. But again, this comes down to the support. So we can help, as little or or be as involved or distant as any particular customer wants us to be. So if they need hands-on help, then we can provide that. If they just need a bit of advice. I think one of the interesting things, certainly on more complex orthoses, is the ability to provide clinicians with a render of the device. So if they have a patient that requires an orthosis that's slightly out of the ordinary, we can design that and send them an image for them to approve before we actually go to print. So that can be quite useful. It allows the clinician to be involved in the process.
Amazing. I mean, that's fantastic that you guys have set up a process that just allows anyone and everyone to be able to access additive manufacturing, and that's great. In terms of the future, I mean, Crispin has been doing this for about 6 years now and has been into the game for about 11, like you said. What do you think could possibly be the future for 3D printing in terms of material, in terms of printing technology as well?
I think that's quite an interesting question, because I think some of it possibly depends on how orthotics and prosthetics is funded going forwards. I know from the experience we've had that development requires investment. So I do think that additive manufacturing is here to stay. I think it's increasingly going to become part and parcel of what we do. So obviously there is work involved around sort of improving and developing new materials, new processes. So we now have a printer that prints in white so that we can provide colours in the orthoses that we provide. And I think, around probably the biggest thing is maybe to try and increase efficiencies in the process. So there are ways we can do that already. So we are governed by the size of the build chambers to what devices we can provide.
Yeah.
So part of what we do to make the process as efficient as possible is effectively the more devices you can produce per print, per build, as we call it, then the more efficient that process is. So maybe going forward, I think maybe possibly larger printers with larger capacity build chambers, which means we can print more devices, and probably shorter print times. Our printer runs on a 17-hour print cycle, so that's 12-hour print and 5 hours fast cool. So we get around that by having multiple printers, but also doing a daily print. So we'll usually put a print on maybe just after lunch, and that will print through the night, and then we can take it off the following day and then repeat the process. So printers that can print in a shorter time scale and have larger print chambers, then that will increase capacity and hopefully will help to improve efficiency and keep costs under control.
Yeah, okay. That's great. I think that's something we can all look forward to. And last question before we call it a wrap for today. I saw that you more specialize in pediatrics and neurology. And I'm just wondering that if any P&O person wanted to specialize in this particular sector or special interest, how would they tie that in with 3D printing? Is there any specific one area that you feel benefits the most from using these devices?
Do you know, I suppose, I mean, we have clinicians within our group that have a wide range of orthotic interest and a wide range of patients that they see. My environment is really quite different and quite specific. As I say, I deal entirely in neurological conditions, and additive happens to be very appropriate for a lot of those patients. If you're in a more general clinic, then the chances are the number of patients that come through the door that may be suitable for an additive product will be less. But certainly down the pediatric clinics, we're finding that the accuracy of fit and the reduction in bulk can be quite beneficial. So I think everybody can access it. The level at which you access it will be determined a lot by the sort of clinics that you do, and obviously
Yeah.
depending on the organisation you work with and what contracts they have will affect the type of patients you see, and as a result, your ability to adopt additive. But I think it's got a place in most clinics. I suppose the level of involvement will vary depending on the type of patients that you're seeing.
Yeah. Fantastic. So thank you very much for this short and nice conversation.
Got there in the end.
Yes, bullet points, and anyone who goes through this can be able to just get all they need to know in such a short time.
Yeah, I think that the website's a good resource. There's plenty on the products, but if anybody specifically has any questions, then I'm quite happy. You've got access to my email address. So if you do
Yes.
get any specific inquiries, I'm more than happy to have discussions going forwards. But as I say, I believe quite passionately in this from a clinical perspective, and for me, the more people that get involved in it, the better.
Fantastic. I personally will take away from this conversation to go check out the education section of the website and see what I can find as well.
Good stuff.
Thank you so much, Ian.
Nice to talk to you. Take care.